Hello, good afternoon. So today I'll be doing a pulmonary function test checkoff. So when doing the procedure, we would always give some instructions to the patient. So one of the instructions that we usually give is we would tell the patient to hold their bronchodilator or inhalers for at least 4 to 6 hours, and also withhold smoking for at least 8 hours prior to the procedure. And then another one is we would instruct the patient to wear comfortable clothing and also let them take light meals prior to the procedure. So when they come in the PFT room, we would always take the height and weight of the patient, and then we will always take note of obtain their pre-assessment vital signs such as their respirations, heart rate, BP, and their SpO2. And then before we ask some questions to the patient, I will always recommend in having this pain assessment score or pain score. So the reason why I include this is I would like to know if the patient is exhibiting any pain. They can try to look at it with the facial expression or the number itself. So with that, if we know what the patient is experiencing, any pain at all, we will try to input it in a report, which may presumably affect their performance later on. So after doing those stuff, we will proceed in asking some questions to the patient. So some questions we usually ask is like their medical history. Aside from their lung history, we will also try to ask some history from the patient if they have undergone any procedures, and then also their medications. Aside from the respiratory medications, we would also like to know if what medications such as their maintenance or any cardiovascular drugs that they usually take. So once everything is all done, we will always input everything in the computer and then take note of their ethnicity, which is very important as it will vary for the test results. So once all of those stuff is done, we will ask and we will try to explain the test to the patient, such as good afternoon, my name is Anthony, so I am a student respiratory therapy, so I'll be the one to perform this test. So the reason why you're being done with this test by the way is what we call a pulmonary function test or simple spirometry. So you were done with this test is because we will try to check your lung capacity and then how much air your lungs is able to hold and move air in and out from your lungs. So when doing the test, by the way, it is very important with our coaching to do a demonstration. So that way the patient would fully understand. So when we demonstrate to the patient, we will always tell the patient such as we will always sit, relax with our back, not in a slouching position, and then chin straighten up. So assuming the patient is on the body box or the plethysmography or using the portable pulmonary function test equipment, there will always be a mouthpiece. So when using the mouthpiece, ensure that your lips is sealed with your tongue underneath. It should not block on this. And then we will put nose clips in here, so that way that all of your breathing is through your mouth, there will be no leak in your nose. So first of all is you will do normal breathing. So as a therapist, you will also try to look at it, the patient's chest rise, and also on the graph. So at least 3 or depending on the patient, normal breaths after the exhalation. We always try to instruct the patient to take a deep breath in. When we tell the patient to take a deep breath in, let them know like they should try to think of it like they're drinking soda via straw. So when you take a deep breath in, like that, that's how you demonstrate it also to the patient. So after they take a deep breath in, you tell the patient to blow as hard as you can or blow air as much as you can. So tell the patient also like they should try to think of it when they blow air out, they're trying to blow a birthday cake full of candles. So when you let the patient blow, try to look at the graph or the loop. It should reach at least 6 seconds exhalation time. So when they take a deep breath in, blow. continue blowing hard. So after blowing hard, instruct the patient to take a deep breath in again. So let's put it this way. Normal breathing. Take a deep breath in. That's how it's done. So after doing the maneuver, usually we do the maneuver at least more than 3 attempts, and then we should always choose the 3 best one. And then usually after doing the maneuver, we give bronchodilator to the patient. And then the reason why we give bronchodilator is we will check later on if there is reversibility compared to the pre-test. So when we give bronchodilators, we will always let the patient rest after the bronchodilator treatment in order for the medication to take effect. And then after that, proceed with the post-FVC maneuver. So once everything is all done, it is also important to take post-vital signs. And then after, aside from the post-vital signs, we can also try to ask the patient their pain score, if how they are feeling. And then once everything is all good, the patient can leave. Then us, being therapists, will try to input everything on our observations, put it in the test report before submitting it to the physician.